More women are having children later in life. And if they're over the age of 35, doctors may use an increasingly divisive term, I guess, geriatric pregnancy. New data shows that many women and men dislike the expression enough to even change doctors. And now one group of healthcare professionals is looking to retire the terminology. Dr. Natalia Llarena from HRC Fertility's Pasadena office joins us now live to discuss this. Dr. Llarena, first off, what is considered a geriatric pregnancy and why is it called that?
Geriatric pregnancy is a term that's used to refer to pregnancies occurring in women at the ages of 35 and older. And the term was established to highlight that we do see gradual increases in the risk of pregnancy complications as women enter these mid-30s. And some of these complications include things like gestational diabetes, high blood pressure in pregnancy, and chromosomal abnormalities that can increase the risk for miscarriage.
Well, doctor, how much of a difference is there in fertility or pregnancy complications before and after the age of 35? Is it as wide a gap as it seems?
It's a very gradual increase. The risk is not going to be the same for every person at 35. So I think it's always important to individualize this. The risks are going to depend on a person's prior pregnancy history. They're going to depend on the person's overall health status, as well as other factors that contribute to the health of the person. And of course, the risks are not the same at 35 as they are at 45. So this is a gradual increase over time.
Why is HRC saying that the term should be retired? I mean, what's the impact to patients?
I think what we found is that the landscape of pregnancy has changed dramatically over the last few decades. In 1970, the average age that women were having a first birth was around 21. And now we see that 1 in 6 pregnancies in the United States are happening in women at the ages of 35 and older. And 1 in 25 births in the United States now are happening to women at the ages of 40 and older. And our goal as OBGYNs and as fertility doctors is always to support the patient toward their goal of having a healthy pregnancy. And what we have found is that the term geriatric pregnancy can lead to increased anxiety, it leads to increased stress, it leads some people to feel shame. And anything that we are doing that is causing shame and distress is not aligned with our goals of increasing outcomes and helping women toward their goal of healthy pregnancies.
Well, then what might be a better term and how much of a difference do you think a new term could make? What would you want to call it?
The ACOG, which is the American College of Obstetrics and Gynecology, and the ASRM, which is the American Society for Reproductive Medicine, both recommend the use of the term advanced maternal age or advanced reproductive age. And I think the term is a little bit less stigmatizing, but I think as with anything, it is important to talk with the doctor and individualize your risk based on your health status and your pregnancy history and your age, since, a terminology never is inclusive of every situation.
Dr. Natalia Llarena, thank you so much for joining us. We appreciate it. Thanks. Have a good day.
Thank you for having me.